A few weeks ago, Governor Kathy Hochul signed legislation meant to support the work being done by EMS workers across the state. The new law will allow for EMS workers to receive a Medicaid reimbursement for on-scene treatment, transportation to healthcare centers, and virtual consultations. In the next segment, reporter Elise Klein dove into the implementation of the law and spoke with state lawmakers about how they're hoping to build on its impact heading into the next year. Here's that conversation.
A new law signed by Governor Kathy Hochul will bring changes to Medicaid reimbursement for ambulance services. Under the current law, when responding to a 911 call, EMS services are required to transport Medicaid enrollees to a general hospital to receive reimbursement. Consequently, in cases where an EMS professional determines a patient will be better served to treat them at the scene, they face not being reimbursed for that treatment care. Some patients need more immediate medical attention and can't wait to be transported. As a result, EMS providers often treat patients on scene. Tim Egan, Executive Director of Rockland Paramedic Services, says about 30% of cases are treated on scene, leaving ambulance services often unpaid.
There's a lot of complex cases that get left on scene. Diabetics that are given an IV and dextrose, cardiac arrests that are pronounced on scene. And in those cases, the cost of preparedness isn't accounted for. The cost of the crew, the cost of the equipment.
Assemblymember Anna Kellis, a lead sponsor of the legislation, stresses the importance of EMS services and on-site treatment, especially for rural areas where hospitals are sometimes hours away.
The service areas in upstate New York, in the most rural areas, are huge. So, perfect example. Trumansburg, New York, which is a village in my district. It is a 2 square mile district, but it has a 250 square mile service area for one ambulance.
Kellis added in cases where an emergency room is full, the ambulance has to wait until a bed is ready, which means a longer wait for other potential emergencies within the EMS service area. Stephen Kroll, chief of Delmar Bethlehem EMS, says EMS technicians have hundreds of hours of training and paramedics have thousands of hours of training to treat people no matter the setting. Kroll stresses that training, staffing, and the equipment needed to respond to emergencies costs money.
Most of us, our budgets are built on the number of times we serve patients. If we serve patients that we should get paid for, but then we don't get paid, it undermines our ability to make ends meet. And essentially, nobody pays us for the cost of readiness.
Kroll also says not everyone needs to go to the hospital. He said one example is when EMS technicians can treat a diabetic with dangerously low blood sugar with intravenous glucose and a snack.
The short-acting sugar we give them needs to be replaced with, say, a peanut butter sandwich. Once we do that, they don't need to go to the hospital. They may need to see their endocrinologist the next day or make a doctor's appointment to find out why their sugar went low, but these are things that occur on a not too infrequent basis we can care for in the home.
The new law could also help reduce stress on the volume of patients in emergency rooms.
Today, emergency rooms are very busy and very overcrowded. They don't need patients that don't need to be there.
The new law will allow for Medicaid reimbursement for treatment in place. It will also allow for EMS services to transport patients to necessary locations other than a hospital.
So, for example, we might be able to take somebody who needs sutures to a clinic, or somebody who needs orthopedic care to an orthopedic clinic.
The governor signed the bill into law in late September, right before a time when advocates said it needed to be signed to go into effect this year. The change to the reimbursement process requires a state plan amendment, which has to be approved by the state Medicaid office. It then has to be approved by the federal government, as New York is funded by 50% of federal Medicaid dollars, and this process takes time.
In terms of a timeline, it's my understanding that that state plan amendment will be submitted to the federal government by the end of the year, by the end of this year. And they'll review it. They'll take the appropriate amount of time to review it. We anticipate seeing full implementation probably by the end of the second quarter next year.
The State Department of Health says they are in the process of submitting the state plan amendment to the Centers for Medicare and Medicaid Services. EMS professionals stress the new law will overall improve patient care.
We always want to be ready for the next major emergency. Someone's having a heart attack, someone's having a stroke. If we're tied up for 2 hours taking someone to the hospital and then returning from the hospital for something we can do in an hour in their home, that's an hour that ambulance is not in service ready for the next emergency.
However, the new reimbursement law is just one part of the larger issue facing EMS services. Ryan Gregoire, the legislative director at the New York State Association of Counties, says statewide EMS services are saddled with pressure to continue providing service at a time when they also deal with significant financial stress.
I have heard from county leaders from Long Island to Erie County to the North Country. Everyone is working on this problem right now. They're hearing from their providers, they're hearing from their community that EMS agencies are being closed across the state.
Gregoire says the new law will provide a little more financial support to the EMS community, but there is more the state could do to help. He highlighted a campaign created by the Association of Counties called Rescue EMS that outlines several pieces of legislation they believe will help bolster EMS providers. One of those bills would declare EMS as an emergency service in state law, which could open up more funding opportunities that fire and police services receive. Gregoire explained police are provided either by state, cities, villages, or towns in some mechanism through tax revenue, and he says it is similar for fire departments.
But EMS, it's a little different across the state, and we need to have some mechanism in place. So when you do call 911 and you talk to a county dispatcher, they're able to send an ambulance to you if that's what's needed.
The legislation passed the Senate last session but failed to make it out of Assembly committee. However, the legislation does seem to have bipartisan support among lawmakers.
I think we need to keep pushing this to be at the forefront until we get to a place where the true cost of providing EMS services in the state are fully covered. They shouldn't be working at a deficit with the incredible service that they provide the communities. They are literally the first step of our healthcare system. They make the difference between life and death for thousands of people every single year.
Republican lawmakers across the aisle stress the importance of EMS providers to New York communities, especially volunteers who save the state billions of dollars.
So we can afford to dedicate a little bit more funding to ensure that there is a consistent stream of funding that makes sure that these vital life-saving services can be delivered.
Assemblymember Steve Otis, the lead sponsor of the bill, says the bill failed to make it to the floor last session due to numerous drafting and bill language issues, such as a lack of specific authorization in county and general municipal law for EMS funding decisions. Borrello speculates the bill also could have failed in the Assembly because it is an election year and some lawmakers may have been apprehensive to make any potential tax changes for local municipalities.
You have a situation whenever you say the word tax in an election year, there's pushbacks.
But Otis argued there is no accuracy to this idea, stressing the issues were largely technical on the bill language. Senator Shelley Mayer, the lead sponsor of the bill in the Senate, echoes the concerns related to county law provisions and ensuring local municipalities have options to fund EMS providers.
I think they want some additional language in there to clarify the responsibilities of counties. There's obviously sensitivity about whether there'll be costs anticipated at a municipal level. We tried to really leave a very wide perspective so that we don't propose a single way of funding EMS. There's multiple ways.
The bill, if passed, would require local governments to make sure EMS is provided to their local communities through funding methods such as private ambulance or EMT services or special district financing.
The purpose of the bill is to give some of those choices to the local governments. There's also a new planning process that's going to occur statewide to further rationalize the system and assist the local governments in understanding what the tools that they have.
He also says there have been discussions during off-session time to resolve the bill drafting details.
It's a complex bill, and the bill deals with public health law, with some education law issues, and local government law. And so I expect that we're going to have tweaks in the bill in both houses.
Mayer says even though the Senate supported the bill as it is currently written, she will also support an amended version to get it to pass the Assembly.
So if there are technical changes in sections of the law or in clarifying that the costs of maintaining EMS can be maintained in any number of ways as opposed to one path, doors open to trying to resolve that.
Otis says the issue is a priority for lawmakers, and he is confident it will have support from the governor's office as well.
I think the agenda is something we all agree on, and so the details are always subject to discussion, but I think we'll get there. I think that the executive has had her own proposals within the budget, and they're all within the same vocabulary that we're talking about. So I'm optimistic.
The governor's executive budget in the past 2 years has included proposals such as creating emergency medical service zones, establishing a paramedic telemedicine urgent care program, and allowing emergency medical technicians to provide non-emergent care in the community. The need to improve the state of EMS and their funding coincides with the needs of New Yorkers' public health. EMS workers say 911 calls are increasing statewide. Del Mar Bethlehem EMS alone has increased their response by 32% since 2020. Next legislative session, lawmakers and advocates say they intend to push for several other bills that intend to help improve EMS funding and ultimately help improve emergency response. Elise Klein, New York Now.
And for more information on the bills lawmakers are hoping to pass next year to provide additional support for EMS workers, you can visit our website. Again, that's at nynow.org.